Mm.
Namaskar. Ahar Arogya Adhyatma, the light of Samskara. Welcome to the program. Here we have a renowned pediatrician, Dr. Veena Tirumalacha, who has worked in Karnataka Medical College, Bangalore Medical College, Mysore Medical College, and also in Kolar Medical College. And she has a vast experience. And more than that, after retirement, she is utilizing her time for a better thing, that Sri Vivekananda Voluntary Organization for the Palliative Treatment. And such a wonderful person with the vast experience. Here today she is with us to remove the cobwebs and the confusions in the mind of the young mothers who have lots of questions regarding how to feed, when to feed, why to feed, whether is it necessary or should they put the top feeding. All these confusions are going to be cleared by her expertise, experienced talks. So welcome, Dr. Veena Tirumalacha. Namaskar.
Thank you very much.
Yeah. The young mothers, in the olden days, the grandmothers, mothers used to teach them and what to do, what not to do. So the motherhood used to go like a relay race from the grandmother to mother and to the granddaughter and then onwards. But today, in a nuclear family, many of the women, they think they're educated, but they don't have the proper knowledge about the motherhood. So please tell me, should they feed whenever the child is crying, or should they feed regularly? At what time interval they have to feed? Should they lie down and feed or sit down and feed? So please explain to us.
Thank you for asking me. I wished this talk will be helpful to some young mothers at least. And I welcome all those young mothers, whoever is going to see to this. There are certain golden rules in the breastfeeding mechanism. The breastfeeding is the best feeding. And we always advocate exclusive breastfeeding for the first 6 months. That is breast milk and nothing else, not even water, not honey, nothing, except maybe some vitamins which are essential or something like that. Only breastfeeding for the complete 6 months. The breastfeeding can start by half an hour of birth, because the umbilical cord is about 18 inches long. That is the exact distance from the vagina, that is the birth canal outside, to the nipple. That means even before the cord is cut, the baby can be put on the breast. So within half an hour, or maybe latest by 1 hour, because cesarean and all that, they have to shift the mother and all that. Within 1 hour, the baby must be put to the breast. And next question is, whatever little comes, it's okay, it is fine. And then whether the mother should sit. Some post-operative cases may not be able to sit. It is definitely okay if she lies down. Sitting is better, I agree. But if she lies down and feeds, there is no problem at all. Somebody can hold the baby to the side of the mother so that the baby's tummy touches the mother's tummy.
Okay.
So, and also, should she feed the baby whenever baby cries? No, she should find out if the baby is hungry. If the baby is hungry, it will, bring the hand to the mouth, open the mouth, does like this. And something touches the cheek, maybe a pillow even. It will touch like this, it will turn like that and search for the nipple, open the mouth. And these are the cues that the baby is hungry. When the baby is hungry, the mother should, if she sees these cues, she will understand. She will put the baby to the breast. But baby may cry for so many other reasons. It may feel cold. Mother gets out of the cot and it may feel colder still. And baby passes urine, a motion. There may be a small ant biting. All these things, it may hurt the baby and it may cry. We need not worry all that. So whenever the baby cries, search for the cues that the baby is hungry and cry.
And then one more thing. As a pediatric cardiologist, I have seen, if the children have the congenital heart disease with the hole in the heart, they have the left ventricle dysfunction. And as a result, they have the chest retractions, and then they are not able to suckle the milk, because suckling the mother's breast milk itself is a big exercise for them. and they get tired and they start sweating, and the forehead sweating will be there, and that is an indication that the heart failure is there. And apart from that, the child stops, it is tired, and it just lies down, and the mother thinks the child is full. But then after some time, again it starts crying because it is not full. So we call this a suck, rest, suck cycle. It sucks, it rests, and then again it suckles. And this, if the mother finds that the child is doing this and the child is not gaining the weight as much as it has to gain, because from the birth to the 5th month it has to double the weight. But if it doesn't, and then that means she has to bring the baby to the doctors, especially the pediatric cardiologist, to find out whether there is any abnormality. And apart from that, we know, suppose the mother is taking some drugs, is it necessary that she should not breastfeed the baby, or she can feed, or take the advice of the doctors?
I'll come one by one.
Okay.
The baby, when the mother is having some cold, cough, some routine disease, some thyroid, something and all that, the baby must be fed mother's milk, because even if a little bit of a drug is secreted, it doesn't harm the baby. Only contraindication are severe diseases like HIV, immunodeficiency disease, and when the mother is on some anti-cancerous drugs, and when the mother is on mental illness, depression drugs, those are the contraindications. Otherwise, she can definitely feed. And the other thing is, once the baby is fed on the left side, next time it is better to be fed on the right side. That I would like to mention.
So almost like our legs, one leg ahead and the next one, in the same way, it has to be harmonious. So this is very important. Yeah.
And regarding the heart disease, there are so many other diseases, particularly the commonest is prematurity in our country. Even premature babies get tired while sucking, because sucking is a very active process.
They don't have the strength. Yeah.
So what we should do is, in those cases, we will have to frequently feed. And another thing is, mother will have a very genuine question to know whether the baby, what she is feeding is enough for the baby or not. We depend on two things to find out whether the mother's breast milk is enough for the baby. One is, count the number of urines the baby passes. If it is more than 24 hours, more than 6 per day, definitely the mother is secreting enough milk for the baby.
Okay.
The second important point is, as you already said, it's the weight gain. The baby should be double its weight in 5 months. And after the 16th day, when it comes back to the original weight, it starts gaining every day 20 grams, 25 grams, 30 grams. The baby's weight gain is very important. The number of urine passed, the weight gain tells us that the mother's milk, which is being secreted, is enough for the baby.
Okay. And now suppose enough milk is not coming. What are the things that you would like to advise? Now, some people have in the mind that the milk is not enough and then it's not coming. Are there any drugs or the vegetables to be given to increase the milk, or it is the mindset that has to be changed? Please let us know.
Nature, as you already so the things I told you about the baby's addition of the milk. One is urine count, second is weight gain. And another thing, even otherwise, she needs a little bit of having given birth to so many. This is the first time. So a person who is capable, good communicator, should tell her that don't worry, it will definitely come. Only the best stimulation for breast milk is suckling, and suckling.
Yeah, I agree. It is like a paramananda. It is a blissful. more and more milk. So it is a virtuous cycle. The baby suckles, and then there is stimulation to the brain, and the brain feels very happy, and the milk comes more. So this virtuous cycle, the mother and the sometimes they have the teeth, they start biting, or sometimes even earlier places there is a fissure in the nipple, and the nipple gets cracked, and it will be very painful. What the mother has to
Actually, nipple will be
do?
happy and healthy when we know the technique of breastfeeding. The nipple is like this, and around that there is a dark circle called areola. Under the areola, the milk ducts gets collected, milk gets collected in the duct. So when the baby sucks, it is not just the nipple, it must cover the complete areola, the entire dark circle. Then
Okay,
nipple is safely inside the mouth.
the
There will
mouth,
never be
yeah,
any fissure, there will never be any cracking, there will never be any
crack,
pain. The baby tummy to the mother, and the baby's mouth completely encircling in the matter of O or oval, the entire areola, nipple will not come. And another thing is, at the end of the milk, the fat rich milk that covers the nipple, that is like a emollient. It will cover and it will safely guard. That is why there is no
oh,
need to soap and
put soap
on
or
the breast too. Every time she feeds, then she need not use soap. She can just have a bath once, and afterwards she can just wet wipe and suckle the baby. That's good enough
yeah,
for the
yeah.
baby.
So, how wonderful the nature is. Nature has given everything in abundance and everything so systematically and nicely. And only thing that our mind has to realize that the nature is wonderful and we have to be grateful to God. And now, in the past, olden Ayurvedic time, in the ancient thing, whenever the mother used to die or the mother never got the milk or something had happened, and they used to select the women who have a good character, good, clean persons, and who can feed not only their baby and this baby also. And in fact, I had also done, from your own college, a cooptation child had come just for 3 days baby, and the mother had undergone cesarean section. So what I did is there was a lady from Goa who had come for her the child's PDA closure. So I made her feed this baby, and in fact the mother was very happy that she was feeding two children, but that child used to pull the mother because it is so possessive that it doesn't want its milk to be given to some other child. And this is something, the human nature and the bonding, it's something wonderful. And today we don't have the many people who are gracious enough to help others, but so they have started the milk bank. What do you say about this milk bank, the
Milk
breast
bank is a
milk bank?
breast milk bank is a
Yeah.
fantastic idea. And previously
Mm.
also, other women who have born children would feed the babies, and you are the best breast milk educator advocate, because you did already all those with the cooptation baby. I really salute you for that. And then the baby's only thing is colostrum. Colostrum is important. Afterwards, the baby adjusts to the whatever maturity the baby has. By 6 weeks to 8 weeks, the mother milk becomes mature. You can definitely breastfeed. So, as we say, contraindication is only a dead mother. Of course, 2 or 3 drugs we mentioned, like mental
Oh,
depressants, and then
that is, yeah,
anti-cancerous drugs, and HIV drugs. So then they have to approach the
absolutely.
mother.
Yeah,
And mother need not feel that her shape will get spoilt and all that. It will, in fact, improve, and it will give a mental satisfaction for her. And all these things to increase the
yeah,
milk,
correct.
so many advertisements are there. You give moringa, you give this greens, the
The
placentas
ultimate, yes.
to
yes.
satisfy the mother.
If the mother minds, she can
Yes.
get plenty of milk, and that's the important thing. And thank you very much for so lucidly, so clearly explaining to the younger mother. Thank you very much, Dr. Veena. We are grateful to you.
Thank you very much. Hope I was of some assistance to some lady at some time, somewhere. Thank you.
ಟೈಮ್ ಸರಿ ಆಯ್ತೇನಪ್ಪ ವಿನಯ್?
ಆಮ ಇನ್ 40 ಸೆಕೆಂಡ್ಸ್ ಇತ್ತಷ್ಟೇ.
ದಟ್ಸ್ ಓಕೆ.
ನಿಮ್
ನಾನು ನನ್ನ ವಾಚ್ ನೋಡ್ಕೊಂಡೆ.
ನಿಮ್ ತಲೆ ಕ್ಯಾಲ್ಕುಲೇಟರ್ ಇಟ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ದೀರಾ ವಿದ್ಯಾ. ನಿಮ್ ತಲೆ
ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ವೀಣಾ. ನೆಕ್ಸ್ಟ್ ನಿಮ್ದು ಯಾವ ಟಾಪಿಕ್ ಅಂತ ಹೇಳಿ, ಆವಾಗ ವಿನಯ್ ವಿಲ್ ಬಿ.
ಅಲ್ಲ, ಟಾಪಿಕ್ ಇಸ್ ದಿಸ್: ಟ್ರಾನ್ಸಿಷನ್ ಫ್ರಮ್ ಬ್ರೆಸ್ಟ್ ಮಿಲ್ಕ್ ಟು ಫ್ಯಾಮಿಲಿ ಫುಡ್. ನೀವು ಯಾವಾಗ ಹೇಳಿದ್ರೆ ಅವಾಗ ನಾನು ರೆಡಿ ಆಗ್ತೀನಿ. ಐ ಸೆಂಡ್ ಯು ದ ಕ್ವೆಶ್ಚನ್ಸ್.
ಅಲ್ಲಲ್ಲ, ನೀವು ಕಳಿಸ್ಬಿಡಿ. ಮುಂದಿನ ವಾರದಲ್ಲಿ ಯಾವಾಗ ಅಂತಂದು ವಿನಯ್ ನೋಡ್ಕೊಂಡು ಇದು ಮಾಡೋಣ.
ಕಳಿಸ್ತೀನಿ. ನಾಳೆ ಅಥವಾ ನಾಳೆ ಕಳಿಸ್ಬಿಡ್ತೀನಿ.
ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. ಸೊ 40 seconds ಓವರ್. ನಮಸ್ತೆ. ನಮೋ ನಮಃ.
It's so nice talking to you, Vidya.
Thank you. Bye.
Bye.